Social media, internet presence, this is reality. Again, in the year 2023, many doctors don't want to do social media. I can tell you, I was reluctant back in, I think, 2017 when I started it, thinking that that's for like, young adolescents. It's not for adults. This is business, and your internet presence and your social media presence is important. This is the face of your practice. So you have to get out there just like any other business. So many options in terms of what's available on the internet: health grades, Press Ganey, Instagram, Facebook, Twitter, university webpage. What is your own personal professional webpage? I advocate picking one social media avenue. I don't think you should do multiple because it really does take a lot of time. I would pick Facebook or Twitter or TikTok or Instagram. I pick Instagram, and I would just focus on that. You have to have at least one strong social media presence. And then many people will say, well, what's the purpose of being online? What's the purpose of it? Why is it so important to have your university webpage or your professional webpage up to date and full of information? And I would say this is that shopping for a doctor is much like shopping for a bottle of wine. I know nothing about wine. I go to a store, I look at the wines, the one with the coolest bottle, I'm like, yeah, this looks good, and it's usually terrible. But I would say it's no different than when a patient shops for a doctor. If someone gets referred to Rick Komatar or to Brian Snelling, what is the first thing that any human being on the planet Earth does? They Google you. It's the first thing they do, right? Maybe back in 1985, no one was Googling, but in the year 2023, people are Googling you. They're going on your social media, and they're going to evaluate you before they see you. And if they go to Brian Snelling's webpage, even though we all know Brian is an amazing neurosurgeon, if they go to Brian's webpage and it says Brian Snelling, neurosurgeon, without any more information, they're going to be like, this dude's kind of whack. Like, I'm not going to go to him. I'm going to go to some other doctor that has an awesome webpage, even though it could be full of lies. So what I'm saying is, obviously don't lie, but your internet presence has to reflect the kind of physician that you are, because that's the face of your practice. So if you have a big publication, put that on your webpage. If you're doing some cutting edge clinical trial, put it on your webpage. If you're using a new technique, like we were talking about, venous stenting for pseudotumor, put that on your webpage. Like, otherwise people are not going to know. So again, invest the time, make sure that your webpage and your internet presence, including social media, does reflect the interesting cutting edge stuff that you're doing.